Hi, my name is Scott Wagoner, and I'm a psychology fellow here at Children's Mercy. And I just want to thank you for hopping onto the poster showcase to hear more about the project that we've been doing in the GI clinic. And so the specific title for this project is Improving Documentation of Pain Prevention Measures for Needle Procedures in a Pediatric GI Clinic. And so just to go over some rationale for this work and our goals for this project. So we know that untreated pain from needle procedures is associated with a lot of poor outcomes. This can be procedural anxiety, this can be even needle phobia, and then eventually healthcare avoidance, particularly in adulthood. And so until recently, the use of pain prevention measures for needle procedures, which is what we call comfort promise, has been limited to inpatient units at our institution. And within the Comfort Promise bundle, there are 4 elements, so comfort positioning, distraction, topical anesthetics, and then sucrose or breastfeeding for patients 12 months of age or younger. And so as we shift, or as our hospital, wants to shift these efforts from inpatient settings to outpatient settings, we want to make sure that a system for accurate documentation is in place to make sure that then we can focus on the uptake of the Comfort Promise bundle. And so the specific goal was to increase documentation of offering of topical lidocaine to pediatric GI patients anticipating a lab draw in the outpatient lab immediately following their GI clinic visit from 31% to 60% by July of 2021. And so this project utilized A3 methodology, and then key stakeholder input was solicited. And through efforts, it was determined that really there were a lack of standardized workflows to help promote documentation in the GI clinic setting, and then also environmental factors such as kind of where the topical anesthetic was located in the clinic. So not really at a convenient place for nurses to retrieve. And so in terms of outcome measures, it's the percent of GI clinic patients undergoing a same-day lab draw in the outpatient lab with documentation of offered topical lidocaine, and then an anticipated balancing measure is GI clinic nurse satisfaction with the clinic workflow that's been changed. And so there have been a number of completed interventions and then a number of anticipated interventions as this project is ongoing. And so in terms of completed interventions, run charts were presented to staff during virtual huddles every Friday. And so this is something that occurred beginning in February of this year. There was an educational presentation that was provided to nursing staff, which occurred in April of this year. And then the electronic medical record was updated to include a hyperlink to the desired comfort promise form in the ad hoc from a different form in the electronic medical record, the MAR, which is where the location of medication documentation has occurred. So kind of a pop-up from one form to another. And this just recently occurred in May of this year. And then we also have a couple of interventions planned. So the development of a standard work document by our clinic nurse manager, and then the modification of physical location of topical anesthetic, or what we have planned to round out our interventions. And so it seems so far that baseline documentation of offering topical lidocaine or anesthetic is low, which suggests that pediatric GI clinic patients may not be receiving adequate pain prevention measures prior to needle procedures, or that barriers in nursing workflow are limiting the proper documentation of when these elements are offered. And so really, as these pain prevention efforts continue to be rolled out through the hospital, we hope that lessons learned from this project can be shared with other clinics to improve pediatric patient experiences with painful procedures. Thank you.